Welcome to Showcase Richmond. I'm Amy Carter. Many people don't realize that hospice care is not only for end of life, but also for conditions that don't improve, like Alzheimer's or Parkinson's. And the services and the support provided by hospice is so incredibly helpful. One hospice provider that has been making a huge impact is Crater Community Hospice, the focus of today's Ask Nurse Debbie segment. With us now are Debbie Johnston with Ask Nurse Debbie and Tracy Tolliver, the Chief Executive Officer of Crater Community Hospice. So welcome to you both.
Good morning, Amy.
Yes, good morning. Debbie, talk about why you want to spotlight Crater Community Hospice today.
Well, I've worked with Crater for many years, and they do an excellent job, and they have been here a long time, and I use hospice for my own mother, and I just think they're fantastic what they do.
Thank you.
Wonderful. And Tracy, tell us more about what hospice is and what you do for the clients and their families.
Well, hospice is a method of care, providing care for those individuals who are facing end-of-life illnesses. It's kind of a medieval process is when it started, as back in those days, whenever somebody was traveling and they had illness or an injury, they would have a place to go where they could get care and be made comfortable. And now in modern times, we're kind of doing the same thing. We're coming to somebody's home and we're trying to make them comfortable and provide them the care they need to assist them through their end-of-life process.
And we should mention that some have a misconception that hospice, quickens death with medication and different things, but that is not correct.
That is absolutely not correct. Hospice, the whole purpose of hospice is, like I said, make somebody comfortable. So we do use medications. We use them in very low doses to start off with to try to make sure that they are not in pain and that they don't have shortness of breath. As time goes on, if they have more issues, then we of course can increase the medications to a level that's appropriate for that particular individual. There are plenty of studies that show that the care that we provide these patients actually can increase their length of time that they're alive. And what we're really trying to do more than anything else is they've gone from doing we've gone to comfort care as opposed to curing care. Because a lot of the care that we provide patients nowadays near the end of life is not a quality of life. And so hospice's pure goal is to make sure they have a high quality of life.
And you all also provide help not just for end-of-life patients, but those patients who may have conditions that just aren't getting any better.
That's correct. To become part of hospice, you have to have basically a diagnosis that's your primary care physician and the medical director for our facility would have to agree that you have a diagnosis that has a 6-month life expectancy or less. But it's not limited to cancer or dementia or to any particular disease process. It's if you have that 6-month life expectancy and you want to be made as comfortable as you can to enjoy and celebrate your life the best that you can during that last 6 months. That's what we're looking for. It doesn't necessarily mean that only 6 months, that at the end of 6 months you're off the program. At the end of 6 months, we hopefully will still be looking after you and taking care of you. But that's if the normal progression of your disease process is a 6-month disease process.
And you all are making such a difference. I understand that Crater Community Hospice was one of the first of its kind in the area, and a lot of other companies have come and gone. What makes you all so sustainable?
Well, the first thing is we belong to the community. Our hospice was formed back whenever John Randolph Hospital back then and Southside Regional Medical Center saw a need in the area. And they formed Crater Community Hospice. They're the ones who got together and formed us as a community-based hospice. And since that time, we've been providing consistent, compassionate care for our patients. Majority of our patients come from word of mouth. We've taken such good care of their family members, and that when another family member or a friend's family member needs assistance, they look after us.
And we want to let people know how they can get in touch with you all since you are making such a difference. 3916 South Crater Road in Petersburg is where you all are located. You can also give them a call, 804-526-4300, or visit them online at cratercommunityhospice.org. And of course, we don't want to forget that this is an Ask Nurse Debbie segment. So if you want to get in touch with Ask Nurse Debbie, if you have a question about your health care, call 804-205-3268. Thank you both.
Thank you.